My name is Carolyn and I live in Selma.
Carol, when you very first came in here, what was your major complaint?
Oh, my back, down my legs to my knees. I couldn't bend over anymore. I couldn't twist anymore. I was just in solid pain in my back.
Good gosh, and that had been going on how long, do you think?
Actually, 40 years.
40
It would be
years.
off and on, since I was 26 years old. But for the last probably 2 months, it was solid. I couldn't get rid of it no matter what I did. The heating pad, the ice, walking, riding a bicycle, not doing anything. That pain was just there. It would
Morning,
take
noon,
medicine to relieve the pain.
Gosh, all right.
It was tough. I'm telling you, I was to the point I didn't know what to do. I thought, well, if surgery, because I had been to chiropractors for years, and they did help at times. So I had thought about that, maybe calling a local chiropractor and going out to see him. But it just seemed so much worse than it ever had been before. So I figured surgery would be the next step, and calling the doctor about surgical, or have a surgeon look at it.
And you weren't that excited about back surgery?
Absolutely not. I saw my daughter-in-law go through that, and she has pain again. It was good for about a year and a half. She didn't have any pain, and now it has come back again.
Yeah, that's the problem.
And she's young.
Yeah.
That makes a difference too.
Yeah. And you've had injections too over the years, haven't you?
Oh, I have, yes. 8 injections at one time from a pain management clinic.
Wow.
He put them in my back. And whenever I first got off the table, because it x-rayed so he would know right where to go, I'd know right when he hit a nerve. But it was not a pleasant thing to do, but if it had taken the pain away, and that was in August before I came to you, I think. So, or maybe it was the year before, but anyway, as soon as he did it, yeah, I didn't have any pain. I could reach down and tie my tennis shoes, and it just was wonderful. Got to the car, and I'm just bragging. I said, I'm going to call everybody I know that has back pain, tell them to come over here and see this doctor. But by the time I got home, the pain was back.
Oh, gosh, you didn't even make it home.
I didn't even make it. But needless to say, there's no point in going back over there again, so I didn't go back. So I've done everything I could do to get help off and on over the years. So this day I was in the living room. I think I might have been on the heating pad at that time where the ice pack won, and saw your commercial on TV.
Oh, yeah.
And I said to my husband, because I knew he could move faster than I could right at that point, I said, get a pen and take down that number. So that's what led me to call you and talk to Susan, and she said, well, come in, you know. So I brought my little MRI report. Of course, you went and got the actual report, so because you said you wanted to see it yourself. Then there's 4 different things wrong with my back, so no wonder I'd been in so much pain.
Right.
But I've been freer from pain the last few days than I have been in years.
Beautiful.
I have. I couldn't cross my legs. Now I can cross my legs either way I want to and hold my book on my lap. There's been several things I've been able to do that I couldn't do before.
Yeah. Walk through the grocery store without pain.
I can go through the grocery store without pain. I can, once again, clip my toenails on the commode, you know. Before, oh, that hurt so bad I was having to go out and let somebody else do it.
Right. And
But
seeing
now I'm
it's
doing
just
my
those
own.
little things that make all the difference.
You do not really realize what kind of trouble you're in until you're able to do these things. I thought, I know I'm 72 years old, but am I supposed to be this stiff? You know, I was just too stiff to do anything. And I realized now, and I had some falls too, some bad falls.
Right.
And
That's dangerous.
Oh, yes, it is. So I realize now it was all due to that back. Now that it has limbered up some, it's remarkable what that little machine and your knowledge and Susan
So
put them all together, and
it
they
sounds
work.
like you're recommending spinal decompression.
I absolutely. You can talk to any of my friends, and they'll say that's all she talks about.
Well, fantastic.
Wait a minute. I mean, it's just been wonderful for me. Don't suffer another hour.